So I appreciate your time this morning. We're going to try to move quickly through our agenda items. And I'm going to, in the interests of courtesy to Mr. Bray, our transportation director, actually start with the second agenda item, which is the 800 level policy. As you know, as members of the board, we're in the midst of this review of all policies, and we're trying to move chronologically through the policies. But on occasion, there's a policy that has immediate impact on school life. And in this particular case, policy 810.2, which speaks to video and audio recording on school buses, has a relevance for us right now. And so I've asked Mr. Bray to be able to provide an overview of the current law and how the policy would be changing in order to come into compliance with that law. And that's why we're moving out of order for this particular item first. So Mr. Bray, they're all yours.
Okay, good morning, everybody. So the current board policy does touch on at least video recording in school buses. It's just kind of not in the right area and has not been updated since Pennsylvania law was updated. Prior to this, there was a little bit of confusion in various districts of whether audio could be recorded on school bus cameras as it relates to wiretapping laws. A few years ago, the Pennsylvania law changed to specifically carve out an exemption for school bus cameras to allow them to go ahead and unquestionably record audio, but it laid out a couple of key points that we need to do in order to keep that audio recording going. Those points are actually written into PSBA's recommended policy here. Most basically, it's just going to define what a school bus or a school vehicle is for us. But then it's going to say that we have to have a board policy allowing us to go ahead and record audio. It's going to say that policy has to be on the district publicly accessible website. And it's going to say that each school year it has to be included both in the student handbook and in any other district publication that sets forth comprehensive rules. So again, that's pretty much exactly what the school board policy says. It will also say that each vehicle has to have signage on board that explains we are using video recording that may include audio, which we have those stickers on board. We have the equipment on board. The last piece of the puzzle here, the only thing that has not yet been implemented is the actual board policy itself.
Thanks, Mr. Bray. So are there any questions about this particular change? Here comes Mr. Needleman. Good morning, Mr. Needleman. How are you? You're muted, but I see you saying good morning. Thank you.
Good morning. Sorry about that. Sorry about the lateness. I just had a little trouble with the link.
No problem at all. I apologize for the confusion.
No.
Mr. Oliver's going to help me to make sure we correct that for the next time. It's because I put a placeholder in our calendars that has a Zoom link, and then we actually create the webinar.
Okay.
So you have two links in front of you, so I apologize for that.
No problem at all. Sorry. I can continue on, please.
That's all right. So we were just addressing the first policy 810.2, which allows the district to provide both video and audio recording, and to do so within compliance, with compliance with the current law. So, so thus far there were no questions. So we would bring this forward as a first reading on Tuesday evening, if you're comfortable with that.
Sure. Yeah.
Okay.
Yes.
Okay. Thank you. So, Mr. Bray, you are free to go. Thank you very much.
I appreciate that very much. Thanks, Dr. Yanko. Thanks, everybody.
All right.
Have a great day.
Okay, so the rest of the agenda is in the 200s. And for those board members who may be unfamiliar with these policies, the 200s are the policies that most directly impact student life. They are sort of the meat and potatoes of school district policy with regard to students. And so we are going to take our time with these policies. If you have specific questions, please don't hesitate to ask. These are the policies that most frequently involve families and students when there are questions that arise. So there's a list here first of policies from policy 200 through policy 250 that had very minimal changes. They were grammatical, not at all substantive changes, in which the PSBA has recommended essentially a status quo to what is the current policy in effect. While there may be a few minor language changes or grammatical changes, they are essentially consistent with what we've been having in place to this point. So we're happy to answer any questions on any of these policies. But if you don't have questions because they're consistent with current practice, we're comfortable to simply recommend them for first reading with minimal changes, and then move forward from there with the ones that have more substantive changes below. Are there any policies that you have any questions about in that first list?
Not in the first list.
Okay. All right. So those will all move forward for a first reading on Tuesday evening. Okay. All right. And so then the next group is the policies related to health and wellness. And there are several health and wellness related policies that we are not yet ready to bring forward. And so at a future meeting, we will go over a few of those. Specifically, so you're aware, there is a policy on diabetes management and a policy on medications, for which we're currently waiting for further guidance from our solicitor. And we're doing a little bit of further research, in particular on the diabetes management, because that is a newer policy for us. And we want to make sure that we get it right the first time. And so there's two additional health and wellness policies that we will be bringing forward at a future meeting. Okay. But Dr. Van Voren has taken the lead on the four policies in front of you: 203, 203.1, 209, and 210.1. So I'm going to turn it over to her just to provide a brief summary of the changes that are occurring in each of these policies, to see what questions you might have about them. So Dr. Van Voren, they're all yours.
All right, well, good morning. So when we look at the health policies, some of them, I mean, as Dr. Yannicone said, several of the ones on the list are basic policies that are across various school districts in Montgomery County, very similar to our own. When we look at the first one, policy 203, that has to do with health records and certificates of immunizations when you register or when you are transferring between schools. Well, within our policy, we state that there's an official form that has to be completed and handed. And so then we started digging, and in meeting with the nurses, there is no official form that has the heading and all of that. What we have accepted is the printout from the doctor's office, and they look very similar because it is PA health code, but the doctor's office prints out all the immunizations, you know, chickenpox, MMR, all of that. And that is acceptable for our nurses to upload into the system, but there is no official form. So we wanted to take off the wording for official form. Also, it talks about medical certificate as proof of getting physicals on the years that you have to get physicals, when in fact, we have included a slip from the doctor's office, the physical form, or if an appointment is made, because maybe your physical, according to your insurance, the annual date doesn't fall at the appropriate time for the student grade. And so because of that, we take just the included slips. So we would like to strike medical certificate because there is no actual certificate to go along with it. And just as a point of knowledge for everyone here, within the district, if people are unable to get that physical on that date due to insurance or because of lack of insurance, we do provide physician and dental appointments through our school district at no cost to the families. So that is important to point out, which is again why we don't have an official certificate to put in. And we do honor those times when a student is delayed due to insurance. So that is policy 203. Did you have any questions about that?
I do have one, Dr. Van Voren, and I'm sorry, I hope this isn't picayune or splitting hairs or anything like that, but to the extent that there is deletion of the term official form, does that open things up to individual submission of information that may or may not be acceptable? And
well, I think that we have to put in, and it might be us looking at wording from an approved doctor's office or in alignment with, you know, PA law that goes with it, as opposed to official form seems so nebulous And every doctor's office, it looks a little bit different, but it's still the same information.
No, I totally agree. Having had navigated that maze, it's a mess. There's no question. I'm just a little bit concerned that I agree. Taking official form, that language, taking it out of the policy makes sense. I'm just concerned, I guess, that we should have some language that just makes it maybe not clear, right? Language isn't perfect, but just something that makes it clear that a parent or guardian or grown-up of a student can't just submit anything, right? You can't just, here's a written letter that the student's fine, here, you know, just so that there's something that we can put in the records, that's all.
No, absolutely, I agree with you. We can put in wording from the forms that are used within the PA code through the doctor's office.
Great, thank you.
So for our notes, Dr. Johnson, I think, let us know if this sounds appropriate to you, that we would say that they must submit a form from a primary doctor's office that aligns with Pennsylvania state law and or the health department registry documentation. And so you all know there is an allowance for families for an exception to submitting this information. But it is a rare instance that we have that occur, where a family has an objection or a recognized objection to submitting their immunization records. Dr. Johnson, is there anything else? Because I know you've worked very closely with this as well. Anything else in the language you would recommend?
No, I think we'll have to wordsmith it a little just to make sure it aligns with the policy. I'm writing in the notes and not in the policy, but I think what you're saying makes sense. And I think we had actually talked about the need for it to be an official documentation versus official form. So it may just be something as easy as that, which is I can print it from my child's online profile, you know, as families sometimes are able to do in today's technology world, but it needs to be official. It's not a handwritten, penciled in document that's created. Right. So I think that, Mr. Ningelman, if I'm understanding you correctly, that's you're weighing in on making sure that we have some constraints and guide rails, but not so specific that it's disingenuous to what we actually do. Is that
no, right? Right, absolutely, perfect. That perfectly encapsulates it. Yeah, encapsulates it. Yeah.
All right, so when we move on to 203.1, it has to specifically do with HIV infection. And it's the whole policy is based on providing a safe environment for all students and faculty. So when we look at this, within the code, it says that under delegation of responsibility, there's wording that says the superintendent or designee shall be responsible for developing and releasing all information concerning HIV infection and infected students. So it seemed a little bit a strange wording because it almost sounded like we were going to provide information about the infected students, which, as we all know, is a HIPAA violation. So we want to refer to students in general and not individually. So it might just, we would like to clarify that, you know, to a superintendent or designee shall be responsible for developing and releasing all information concerning HIV infection, and, you know, striking the infected students piece of it, because if we're having information about the infection, then that has to do with the people that are within that building to begin with. All right, moving on to 209 for health examinations. This talks about the screenings and the required physicals that you need within different years of school. So when you look at this under guidelines in paragraph 4, it talks about TB tests. So it says a school nurse or medical technician shall administer to each student vision tests, hearing tests, tuberculosis tests, and other tests deemed advisable, height, weight measurements, and so forth. But in fact, we do not administer TB tests at the building. They are required for high-risk students, but that is then provided by community providers or your primary physician. It still would not be administered by our school health personnel. So we would like to delete TB tests from the list. And then as a point of clarification, there was a waiver that was sent out to all the school districts in Pennsylvania that you could take part in. It was in 1997 that actually omitted TB tests from being a requirement for school. And we do have that on file. It was signed in 2016. Just giving you further information of why TB tests don't necessarily need to be on our list. Any questions? It's exciting stuff. Stay with me, folks. All right, the last health policy has to do with possession and administration of asthma inhalers, epinephrine auto-injectors. So when looking through this, under student self-administration, it says in number 2 that a written statement from the parent or guardian acknowledging that the school is not responsible for ensuring the medication is taken and relieving the district and its employees of responsibility for the benefits or consequences of the prescribed medication. So that is not actually on the form that we have. So here we have something that is within our policy that is not on the current, it's not our current practice that we're using within the buildings. Also, number 5 in that same list, it talks about a written acknowledgement from the student that he or she has received training on how to use it from their doctor. And so we also do not have this on our form currently. Thank you. Which again, practice versus policy doesn't match up. So in looking this, we would like to amend it and look through here and figure out exactly what written acknowledgement. Within this section, it talks about student self-administration. So there's even the idea of, you know, grade level and developmental spans of students where a 5-year-old may not be able to sign a written statement that they've been trained to use their EpiPen, where it might be perfectly feasible for a 16, 17-year-old to be able to look at that. So we would like to amend those forms and make it one form, not 2 separate forms. So we're going to be in the process of doing that so that we have one form that covers this same information and brings the practice to the policy. Also, under training, our policy states that the nurses, all the way at the bottom, it says that a list of school district employees who successfully complete such training shall be maintained, updated, and kept in the school nurse's office and the school district administration office. So every year, every single one of our teachers goes through a training for this very thing, how to administer this kind of medication, should they be on a field trip, should there be an emergency situation. They actually go through an online training and then they have to do a physical training where they have to demonstrate that skill in front of our trained school nurses. They then get a certificate that the nurses signed and we put it within their HR file. As we're looking again, policy versus practice, we have this on file, but the nurses don't have it. So this is important information. So what we would like to do is just to let you know, we would like to provide this same list that HR has on file to the school nurses so that we can bring practice to policy, which is currently not being done. Any questions on 210.1?
No, that makes sense.
Mm-hmm.
Thanks, Dr. Van Born, for that explanation. You can see here, the vast majority of this policy is in boldface. And the reason for that is there are significant changes. Just want to remind our board members at the bottom, I was taking a minute to jump into my action where you can see the draft in the cross-reference. You'll recall if you're looking at the changes. So if I go to 210.1, you can see a summary of all of the changes that occurred in that policy by PSBA. And then in the far right-hand column, there may have been additional recommendations either for us to review it with our solicitor, which may be underway, for example, in 210 with medications. There may have been a recommendation to review the administrative regulations. And so some of that occurs after the policy is approved. So in the cross-reference, anywhere you see a recommendation for the administration to review the AR, those are the practices, those are the administrative regulations that we follow from the policy. So the first step is to amend the policy, and then for our administration to take that board-approved policy and either create or revise the administrative regulation. We are planning this summer, hopefully at the conclusion of the policy review, to take all of the revised policies and all of our current administrative regulations and create a policy manual that would then be provided to each administrator, rather than having them have to go out to the website to review those ARs. That's our intention looking ahead. Okay, so if there are questions between today and Tuesday evening on any of these policies, and you want to say, oh, what did we talk about again? The summary is in this cross-reference document for you. And I'm hoping that that's helpful to you. Okay. All right, so those are the 4 health and safety policies that we had on our list. Are there any questions at all about that before we move forward with the student life related policies? Everybody's okay? Yeah, okay. All right, so the next policy, and I'm going to actually just pull up the policies. I think that might be easier.
Dr. Yannicone, I'm so sorry. Can I just interrupt very quickly with a very quick question? Just because I anticipate that it's already come up, and I anticipate it's going to come up some more. We are not at this time anticipating adding anything to the list of what is required for entry
under
into school?
immunizations. Understood. And I think that's an
Is that right?
important thing. Yes, correct.
Okay. All right,
We do not add, so for the board's information, because I do anticipate that this may come up on Tuesday evening, in policy 203, we do not create the list of required immunizations. The Pennsylvania Department of Health does that. And so there are occasions, as Dr. Van Voren mentioned, where something like the tuberculosis test, you can request a waiver of that, right? And then there are also options where if a family's insurance does not cover particular tests, we can provide dental assessment or a physician's assessment, as Dr. Johnston mentioned. But when it comes to the list of immunizations that are required by the state for enrollment in school, that comes directly from the Department of Health. At this time, there have been no immunizations added to that list. And whether or not that occurs will be a decision of the Pennsylvania Department of Health.
And that's later.
Later. And we're later or never. I don't know, we don't know whether or not an immunization to COVID-19 will ever become a requirement. And then, thank you, Dr. Johnston. The other thing I want to make sure you're aware of, and then I'll turn it over to you, Dr. Johnston, is that there are always options for families currently to request exemptions to that immunization record. And there's a practice for that. There's a policy for that. Dr. Johnston.
Approximately 4 years ago, the Department of Health, the Pennsylvania Department of Health, required a meningitis vaccine to occur for students in the prior to their senior year in high school, because they determined that the evidence suggested that you needed a booster of that immunization going into that part of your adolescence. We received that information from the department in a bulletin, for example. I'm going to tell you, it was like in December or January, 6 months prior. More than 6 months prior, we began communicating that to families 4 years ago that spring with a rollout for the following fall. And then we provided as much guidance and support as we could to individual families to get up to speed with that change. So just as an FYI of an example, like that's the rollout that's the last time I recall, Dr. Van Voren or Dr. Yannicone, maybe you remember another one, but that's the last time I remember a change to the immunization schedule coming from the Department of Health. And I'd have to look to get you the exact year, but it was way before COVID. I'm going to say about 4 years ago. I hope that's helpful.
Yeah, no, thank you.
Okay, Mr. Oliver noted that there was a hand raised in the attendees. Just want to reinforce that the opportunity for comment will come at the end of the agenda. Okay, so hold that question for now. So we have 7 student life policies. The first is searches, policy 226. This policy did not really have too many substantive changes, but there was a comment from our team about the fact that we have tried to work with regard to gendered language in our policies as we've moved through the process as part of our equity work. And so in policy 226, you're going to see a few things that we've retracted. The first is that we do not use metal detectors, and so we have removed that from the policy. You see where we've struck that and just left other technology. That doesn't preclude the district in the future. If you ever wanted to install metal detectors, the policy would still be in effect because other technology would include that. But given that we don't currently do that, we wanted to strike it from the policy. And then in addition to that, there's a section here about searches that involve removal of clothing or examination beneath clothing. And so we wanted to try to make sure that instead of the language in the recommended policy stated that this would be a member of the opposite gender who would automatically conduct the search. And in trying to be mindful of our inclusivity goals, we changed that to say it would be another staff person of the same identified gender present as a witness and in a location assuring privacy from observation by persons not involved in the search or of the opposite sex. And we just added a sentence, every effort will be made to help the student feel comfortable during the search with regard to the gender of the adult conducting it. And so wanted to ask for your feedback or questions on that particular change that we were looking to make, in particular for our students who are non-binary or perhaps don't identify with the gender assigned at birth.
Dr. Yannicon, I guess a question I have is it a possibility to word it as that the student gets to select the gender of the person performing the inspection based on their comfortability? Or does that give too much? I guess, does that work within the sort of safety standards of this? If they can, obviously not the individual, they can't identify the individual they want, but they can at least identify the gender they'd feel most comfortable with.
Right, I think the intention here, if you would like to add language, just let us know where you'd like that language added. But our goal here is that the student would be identifying that gender. It would not be the adults involved. It would be the student.
Okay, so I see the word identified, but I don't see the part that the student gets to.
So let's see, so we could put in here, let me go to the edit button. So if I go back to that section, I could say of the same student identified gender.
I guess, and I don't want to go too much into detail in this time, and so I'm happy to continue, afterwards. But it's actually the word "same" that is, I would suggest striking, because someone might identify as non-binary but prefer a female identified person to do the search, and so I'm trying to make sure the language allows for a non-binary student to select someone.
Okay, so in those two places I see it. Does that meet with your goal?
Yes, thank you.
Okay, terrific. Are there any other questions around searches? Beyond that, the policy is largely consistent with current practice. You can see that there's very little here that's in bold or changed by PSBA. And again, you can go to the cross-examination to verify what's happening. Okay, all right, so then 229 is the next policy. These are very easy overall. So policy 229 on student fundraising effectively could have been in the minor changes area, but our principals, I wanted you to know that I reviewed each of these particular policies with our principals because we wanted to make sure that they were in solid shape. As far as current practice. Any questions? Okay. And then the next one is 231, social events and class trips. Again, this policy has no changes. Oh, yes, Ms. Hughes.
I'm sorry, Dr. Yannicon. On the fundraising, does that also include, like we've had the experience where there was a fundraiser being led by the teacher in the classroom?
And this includes any fundraising, right, that could involve, remember, that would involve potentially students being a captive donor and anything that might disrupt the educational program of the schools. the goal here essentially is not to have us not become a business essentially.
Okay, thank you.
Absolutely. So the social events and class trips, there are no changes recommended by PSBA, but I wanted you to know that our principals did review the policy just to make sure that what we're currently doing is in line with expected practice. Okay. And then the next one, 233, is suspension and expulsion. And this policy as well, you can see, there were not too many substantive changes. The one area is this area down here under attendance and schoolwork after expulsion, and PSBA is recommending a change in the compulsory school age. And this reflects current Pennsylvania State Code, which is referenced here in 1 and 10 and 11 that follow that statement. Are there any questions about suspension and expulsion? Okay. And then the next one is 247, hazing. Now, hazing has had, as you can see, substantive changes. This is a significant variation from current policy, and again is based on current Pennsylvania State Code. So if you go to the cross-reference and you scroll, and I know you all have access to this, but I'll scroll down for those who are joining us. If you go to hazing, you can see exactly what has been added. So this is related to Act 80 from 2018 and updates to the hazing policy within the state of Pennsylvania. It also includes references to Title IX, discrimination and harassment, right? So we had discussed at a prior board meeting and at prior policy committee meetings that the 103 and 104 policies on discrimination and harassment had been updated by PSBA to reflect current law, and a lot of Title IX language has been incorporated into these policies. So the policy on hazing is quite involved with regard to the complaint process, the investigation process, the responsibilities of the district that can lead all the way up through expulsion with regard to a hazing incident. I did want you to also know that there is information in this policy. There are references to expectations for the district as far as education is concerned. We do participate in the Positive Coaching Alliance. Oftentimes hazing is associated with athletics, interscholastic athletics. And so we have worked hard to make sure that our Positive Coaching Alliance training for our student athletes, our coaches, that happens on an annual basis, as well as our Safe Schools training modules for staff and students to make sure that we're as up to date in informing our community in clearly why they should not be hazing, but also the consequences for violating the hazing policy. Are there any questions about this policy? Okay, and then the next policy, 249, that's listed, that policy has some substantive changes as well. This is in the bullying and cyberbullying arena. And again, there have been some significant additions and changes as a result of Title IX. And so you can see here the bar for the administrative team in our investigation and administration of consequences is significant. The one area that I will tell you continues to be a challenge for us as administrators, and this is an area where our administrative regulations will really need to be reviewed closely by our solicitor as we move forward after the policy is approved this summer, is that there is language in this policy in the definition that continues to cause challenges for districts with regard to the extent to which we can be involved in cyberbullying that occurs outside of school hours, off school grounds, using students' social media accounts. And so this, this definition here where it says it must be severe, persistent, or pervasive, and has the effect of doing any of the following, not all three, but any of the following. So if it substantially interferes with the student's education, if it creates a threatening environment or disrupts the orderly operation of the school, we are now expected to intervene. And that has certainly raised the bar for administrators in the kinds of complaints that we might receive from families or from students. So I just want to make you aware of that. We are aware of it. We've been working in this area, but I did want you to know that it does, it heightens the expectation for us as a district. Are there questions or concerns about this policy?
No.
Okay. And I will tell you in our AR that we'll work on this summer, we will also look very closely at the current training that we provide to students, to staff, and to administration. And we will make adjustments as we feel they're necessary to respond to the updated policy. Okay. Once again, in the cross-reference, you'll see a summary of those changes and the rationale for them. Okay. And then 252, dating violence. This is, again, an area where Title IX has had a significant impact on expected procedures, the complaint procedure and the investigation procedure for our administrative team. In addition, you can see there is a brief statement there about dating violence training. And I do want you to know that our second step child protection unit that begins in early elementary school, and then our middle school health curriculum and our high school health curriculum all include training for our students on dating violence, resources for the students. And we also at the middle and high school level, prior to the pandemic, and we're resuming that this spring, we bring in outside trainers specifically focused on dating violence, how to avoid being in that situation, how to report if you are concerned about you or a loved one or a friend being in that situation. So any questions at all about this policy? Okay. All right, and so those are the 7 policies. I'm going to go back to the agenda, get back to the meeting agenda. So those are the 7 policies related to student life that we're currently ready to bring forward. There are several others you notice I skipped. We are awaiting some solicitor guidance on a few of the policies, where in the cross-reference you'll see that we were recommended by PSBA to also consult with our solicitor. So we'll bring them forward to you when we feel that they're ready. But these we all feel are ready for first reads. And then there are a group of 5 policies that PSBA has recommended that we delete. And you can look in the cross-reference to see why. I want to be clear because at our last board meeting, a statement was made that the policies that were being deleted on that evening, the intent of that policy had been moved to another location. That is the case with unlawful harassment, 248, and with 250.1. It is not the case with 209.2, 211, or 213. These 3 policies, if you take a look at the recommendations from PSBA, they're recommending we delete them because they believe they should be in an administrative regulation, our own policy, but manual, but not necessarily a district policy on those items. And so that's why they're recommending that they are deleted. Okay. So any questions about those deleted policies right now? So what we would bring forward next week would be first readings of the first 3 sections of policies and policy 810, which we discussed at the beginning, the audio and video on the buses. And then we would recommend deleting these 5 policies per PSBA guidance. So these board motions would be added for Tuesday evening. Okay. Are there any questions about that? Okay. All right. And certainly if questions arise between now and then, don't hesitate to ask. So our last agenda item is public comment. And so the guidelines for public comment are that we have our instructional technology coordinator, director, Mr. Oliver, who's going to unmute and raise up to a panelist any community member who and I'm going to stop share because I don't necessarily need that right now. Any panelist who has a question or attendee who has a question. So I see we have some community members. If you raise your hand, Mr. Oliver will move you into the ability to ask your question. And again, the questions should be focused on any of the agenda items today. So Mr. Oliver, is anybody raising their hand?
I see no raised hands at this time.
Okay, thank you. So that would be our last agenda item. For the board, are there any other policies or questions that you have that you would like to see brought forward at our next meeting? And that'll be my last agenda item, that we would like to tentatively schedule the next policy committee meeting for the Thursday prior to our next board meeting, which will be on March 15th. And our hope is to bring you some additional policies related to student life, as well as some policies that Dr. Johnson is working on right now with our social workers. We have a number of policies that we're having our clinical team look at before we bring them forward to you, and they would be ready for the next meeting. Is this 8:30 a.m. time good for you?
It is.
This is good for me, yes.
Okay, better, Amy, I know, because of your schedule.
Yeah.
And Sarah, does this work, or do you need us to move more like 8:45 because of drop off?
No, it works. I will keep getting my family used to a slightly earlier departure these days.
That's fine. Okay, so we'll schedule for 8:30 a.m. on the week prior to the next board meeting. Okay, and we'll send you all an invitation. All right.
Thank you.
Dr. Yannicombe, if you still have a public comment section open, we do have one hand raised. Amanda
Sure, of
Rizzo.
course. Okay, Mrs. Rizzo?
We'll allow her to talk.
Sure, of course.
Hi, I have a question because my daughter has diabetes, and that was one of the policies that you were bringing up.
Thank
And
you,
I
Mrs.
just-
Rizzo.
That's fine. I was, this has been an ongoing thing, so I'm very interested in what the policy updates would be, just because, as you know, like we've been kind of working through with the school nurse and athletics. So if I don't know how to find out when you are continuing to talk about it, what it is you're talking about updating, because you said you're tabling it for additional information, or so.
Yes.
That's
Yes.
just something I'm specifically interested in, just because my daughter's going to high school next year, and so I'm trying to I work with CHOP a lot about what we should be working through, and one of the things that came up is that our school is not part of one of the acts that went through Pennsylvania, and I wasn't sure if that was part of the policy. I can't specifically remember what it is off the top of my head, but basically it allows children to manage their diabetes on their own while in school. And you guys have been awesome in allowing Frankie to do that. I just, for the kids that are coming up, think it's something important that our school looks into. And I'm concerned because it took so much time to get Frankie acclimated to handling her diabetes that I don't have to repeat it in high school. She's having a really, really amazing experience now, but it took a lot of time to get all the teachers and staff comfortable with it, because she does everything while she's in class. Like it kind of is jarring to people. So I just wanted to understand what the policy updates would be.
Absolutely.
If that makes sense.
Yes, thank you, Mrs. Rizzo, and I appreciate you raising the question. So the reason why the next policy committee meeting, which again will be 2 Thursdays from today, that meeting we will discuss the diabetes management policy.
Okay.
We have it on hold right now because it's a brand new policy, and PSBA essentially loaded the entire new policy in to our draft policy manual, which is what the board will be reviewing. For board members, if you go into the policy drafts that you have access to, you will see policy 209.2, diabetes management in draft. And Mrs. Rizzo, what we're waiting on, the act I think you're referring to is Act 86. So Act 86 and the Pennsylvania Department of Health have provided resources for school districts in drafting this new policy. And so
Okay.
we are reviewing the act and the resources to make sure that our policy will best support our students. And then we also, Dr. Van Voren is working with our nurses and reaching out to the MCIU to make sure that we have a comprehensive policy for students moving forward. Dr. Van Voren or Dr. Johnson, I don't know if there's anything else you'd like to share for both Mrs. Rizzo and the board members at this point.
Hi, Amanda.
Hi.
So yeah, you know what? In our policy, it starts talking about trained personnel outside of the nurse's office. And so along with allowing students to have the ability to give themselves their own medication and along with updating Act 86 and all of the new language within our policy, what's happening is they're asking, it's almost like, you know, with the EpiPen, teachers are trained for the EpiPens. Some aides are trained, not all with the EpiPens. And so we look at that now, that's a new wording for the diabetes management policy. And so it's questioning the different levels of, you know, obviously the nurse is the primary. Is there a situation? How much training does the teacher need? How much training would a paraprofessional need if that was instituted as a necessity? So those are specifically what we're reaching out across the county to look at, along with adding all of the new information for Act 86.
Okay. Because a lot of things related to sports came up as well, just as a, in terms of training with the glucagon. And since that's
right. And that would be the
different.
personnel. That would be another level of personnel that would need the training. And then would that be the Department of Health? I know that when we had training, my gosh, I think it was like 6 years back, CHOP provided the training. So it's really getting that organized, getting ourselves organized and making sure it's all in the policy.
Okay, great, thank you.
Thanks, Mrs. Rizzo. We appreciate you raising the question.
Thank you.
Okay, Mr. Oliver, does anybody else have a hand raised?
Yes, we have Cindy Dowling.
Okay, Mrs. Dowling.
Hi.
Hi, Mrs. Dowling.
I hope you're all well today. I just had a question because I know you're talking about policy a lot, and then we have the health and safety plan. So I'm just wondering, the health and safety plan is not policy, right? So it's just implemented for, I just didn't understand the difference. You know what I mean?
Sure, absolutely. So no, the SDST health and safety plan is not a policy, but the board is expected to implement a health and safety plan under the current conditions. So every 6 months, we have to update that. And that's as a result of the Pennsylvania Department of Education. So while you won't in the large list of policies see a specific policy that mentions the health and safety plan, they are required to maintain, in general, to follow health and safety standards. So as an example, some of the 200 level policies that Dr. Van Voren was reviewing, these are all related to health and wellness, right? So there are expectations for us within the policies that are related to the health and safety plan.
Okay, so then how long will you have to keep the health and safety plan in place?
It's a great question. We know right now that we have to keep it through the end of this school year and that we are expected to update it every 6 months. If the state lifts that requirement, then the board would no longer have to approve on a semi-annual basis a health and safety plan. But as long as the state is requiring it, we are expected to follow their guidance.
And then when that's done, you won't be implementing anything from the health and safety plan into policy unless, is that right?
That's right. When the Pennsylvania School Boards Association, who is providing us all these recommendations for board policies, when they provide this guidance, it's based on whatever is in current Pennsylvania state code, whatever is in current federal or state law. And so they'll ask us to update our policies to be in alignment. So like you heard today, we're making a change to policy 810 related to video and audio recording on buses. That's based on changes to law. The most recent, comment from Mrs. Rizzo about diabetes management, there was an Act 86 came into approval from the state that requires us to have a policy on diabetes management. So it's a new policy. So in theory, the state could require a policy that requires a health and safety plan updated on an annual or however they liked, but currently that doesn't exist. What exists is health and safety plan must be approved at the board level every 6 months.
And that's basically based from the state. So you just have to follow whatever they say.
That's right. And then, like, for example, the masking on school buses is because of federal law. So there are some federal guidelines that we have to follow and some state guidelines.
It's not a law though, is it? It's just a guideline from the federal level.
My understanding is it's a federal mandate. Mr. Needleman, I think.
Yeah, yes, sorry to jump in. I just, under the Federal Department of Transportation, any common carrier is required to have masking. Buses are considered common carrier or under that umbrella. So that's how it's actually a requirement of the federal government, similar to, anyway.
Is that for public transportation though? Aren't you guys a private bus company, or are you a public, or do you know what I mean?
Yeah,
school buses are considered common carriers.
They are, yeah. Plus they're subject to federal regulation.
Yeah. What happens, Mrs. Dowling, is if we ever have a question, the district retains a solicitor. So we have Fox Rothschild as our solicitor. So you've heard me mention today in this policy meeting, there are some of our policies that, in addition to being reviewed by the Pennsylvania School Boards Association, they're also reviewed by our solicitor. And that's to make sure that we're in compliance with all laws that would impact school districts. So they provide us regular guidance and help us to stay in compliance with the law.
Okay. I'm sorry, I just have one more question. I know that somebody had brought up recent fights at the school at the last school board meeting. And I was just wondering, I know that you guys were given money for like mental health and things like that. And with everybody coming off of this pandemic, because it's now pretty much wrapping up, I think, like, what are you implementing to help kids? Because I see it all the time in my private practice that kids are struggling with isolation and just, from having to be online and then not really connecting because of these masks and everything. What's going to be provided in the school for kids? Because I feel like the fighting is kind of part of that. Do you know what I mean?
Sure. Thanks, Mrs. Dowling. Yes, this is absolutely ongoing, pre-pandemic, during the pandemic, and following the pandemic. Mental health services and resources for students are an important component of our educational program. Dr. Johnson has been working with our clinical team, our social workers, school psychologists, school counselors, as well as outside agencies with whom we contract to make sure that students are getting the services that they need. I would encourage you to watch the video of our academic affairs meeting from February 7th. Dr. Johnson actually provided an overview of where we are with regard to those mental health assessments and programs that are currently in place and planned for the future. And then I would encourage you to reach out to her directly if you had any specific questions. After you watch that, I think that she provides a very comprehensive overview, but then you could reach out to her and she could provide you some more specific details.
Okay, is that is that from a school board meeting or a?
Yes, if you go into board docs and you select meetings and you look in the 2022 meetings, you'll see the academic affairs meeting on February 7th. And when you go onto the screen for that meeting, you'll see, like, on the far right, there's an icon that says video. And you just click on that and you can watch the whole meeting.
All right, great. Thank you.
Absolutely. Okay, Mr. Oliver, do we have any other questions?
No other hands raised at this time.
Okay, thank you very much. So Dr. Johnson has taken notes and she will provide them to the committee. And then I'll just need to know who would like to make the report on Tuesday night. And then we can move forward from there. I think, Ms. Green, did you provide the report? last time? And are you comfortable providing that again? Or would somebody else like to take a turn this Tuesday night?
Doesn't matter to me. I can provide the report or someone else can take a turn. That would be great.
Okay, so I'm going to ask Ms. McKenna to include you as the presenter of the report in our board agenda, which is aimed to go out tomorrow. And Dr. Johnston will make sure that you get the notes. And if you have any questions, just don't hesitate to ask between now and Tuesday.
I will. No problem.
All right. All right. Well, this concludes our policy committee meeting on February 24th. Thanks very much to all of our attendees from the community and our board members. And we'll see you in 2 weeks.
Thank you, everybody.
Well,
Have a great day.
everybody. See you.
Take care.